Why do we need universal pharmacare in Canada? Free healthcare is a source of pride for many Canadians. However, the current patchwork system of pharmaceutical coverage in Canada allows for many people to fall through the gaps. Being unable to afford the out-of-pocket costs of prescription medications is an unfortunate reality for many living in this country. Research suggests that as many as 1 in 10 Canadians who receive a prescription report cost-related nonadherence. Cost-related nonadherence, or CRNA, occurs when an individual skips prescribed doses or doesn't fill a prescription because they cannot afford the out-of-pocket costs. It is different from other individually motivated types of nonadherence, such as those relating to ideological beliefs, because it is influenced by structural factors that are beyond individual control. Non-adherence to prescribed treatment regimes can potentially have negative impacts on health outcomes and take away from the overall quality of life of an individual. Other research shows that some individuals opt to borrow money to cover the out-of-pocket costs of their prescriptions. This includes maxing out credit cards, taking out loans, and even remortgaging houses. Around 2.5% of Canadians reported doing so, which may sound low, but that equals over 700,000 people. The accumulation of debt can lead to all sorts of negative outcomes for individuals pertaining to both their quality of life and their health. Both CRNA and borrowing to finance the out-of-pocket cost of prescriptions disproportionately impacts low-income individuals as well as those who are already in poor health. Something needs to be done to protect these Canadians. Implementing universal pharmacare would be a big step in the right direction when it comes to achieving equity in Canadian healthcare. It would ensure that regardless of factors such as age, gender, income, and overall health, all Canadians would have equal access to the medications that they need. It is time for Canada to follow in the footsteps of other countries that have both universal healthcare and universal pharmacare. For example, in the UK, British citizens and permanent residents receive free universal healthcare, including prescription medications, through the National Health Service. Most only have to pay a low flat rate for their prescriptions, and many vulnerable groups, such as anyone 60 or over, anyone under 16, and anyone who receives government support, are exempt from this. At this point, you may be asking yourself, why don't we have universal pharmacare yet? As you may expect, the excuse is that the cost would be too great. However, the research shows that universal public drug coverage would reduce total spending on prescription drugs in Canada by $7.3 billion. The private sector would save $8.2 billion, and the cost of the government would only increase by $1 billion. In conclusion, Canada needs to follow in the footsteps of other nations such as the UK, who have successfully integrated universal pharmacare policies into their universal healthcare systems. The research shows that the cost is not a sufficient excuse to avoid universal pharmacare. It is time to put the needs of Canadians first. It is time for Canada to take an important step in achieving equity in healthcare through the implementation of universal pharmacare. Every Canadian is entitled to the treatment prescribed to them, no matter how much money they earn or the condition of their health.